we're about to go to the panel next, if that's all right, if the panel members would like to come and sit up. And Alastair is very kindly going to chair this because he feels he's already spoken, and so Fiona is very kindly going to stand on the panel and answer questions from there, so you've got an opportunity to actually talk to her, which is brilliant.
Yeah? You do it here or you do it there? Is Rebecca, you staying or not going?
Look, you don't have to. You don't have a rest. Right. How much time have we got? Are we late? A little bit late. Okay. Right. So you've heard from all of us apart from Fiona, who's don't know how to describe Fiona really.
Describe myself then.
Okay, you go. Dickon, who is as well as having, we were talking about Johnny Cash songs earlier.
Boy named Sue.
Is a child and adolescent psychiatrist. Daniel Zeichner is totally disloyal to his leader. He's not wearing a Dickon linen jacket, but he is the newly and elected Labour MP for Cambridge
City and strong Remainer. Well done, you.
And Carol we've already heard from. Now Fiona and I were going to do a sort of Mr. and Mrs. We were going to do a Mr. and Mrs. double act, but she was delayed. So I want to kick off by asking Fiona, just to sort of, from her Guardian educational campaign expertise, just to talk a little bit about mental health policy in the education policy space, just her assessment of where we are with it now, and then I'll bring in the panel.
Okay, well, thank you. And I'm very, very sorry I wasn't able to be here this morning, but I'm actually dealing with an elderly mental health issue in my family, which is extremely difficult. My children have all grown up now, and I've got a very unwell mother, and it produces a lot of pressure. So as a school governor, I see the impact of all these things in my school all the time, and as a daughter, I feel it at the other end. Now, I think everybody's analysed the problem very successfully. The only other point I would want to add to the ones that are already made is that this is a big equity issue, because actually there are lots of families who can afford to access mental health services if they can pay for them. And we live in Hampstead, which I think probably has more we've got 5 psychotherapists on our street. I mean, there are more therapists than analysts in the square mile we live in, along with more state and private schools than anywhere else in Western Europe. And there's plenty of families who can get it. It's the children who can't get it are the poorest ones. And that is a really big issue that we should all be very worried about. I wanted just to say something about schools, because I think it's very important to remember that schools are by and large very safe and happy places. I mean, they are the one place very often that children can go to get away from some of these things. We do face immense pressures at the moment, for, cuts to services in and out of schools. But just think about I think about my school this week. You know, the head teachers had a terrible year with an unexpected performance indicator that went wrong, an Ofsted inspection. On Monday, a member of the senior team died. In the afternoon, there was an incident in the street outside. And also think about the families and the schools in the area around Grenfell Tower are going to have to deal with the fallout of that situation. In spite of all that, head teachers get their schools running every morning, and they're by and large happy and safe places. So we've got to celebrate the best in schools, and I don't like this sort of image that we sometimes get of schools as very unsafe, negative places. We definitely need more money. I mean, I know Cambridge is right at the heart of this campaign. This campaign has been fantastically successful in the general election. It did sway a lot of people's votes. It wasn't decisive, but the campaign to get more money into schools is absolutely critical now. I mean, Justine Greening has a majority, I think, of under 2,000 possibly. She's the person who's going to be dealing with this, and we've got to put pressure on the government to make up the funding gap that exists in schools, because there's not a hope of addressing any of these issues until that happens. The second thing is a wider point. I mean, what would happen if we put children at the heart of every single policy-making issue? I always think of Tawny, you know, what a wise parent will wish for his or her child, the state should wish for all its children. We're so far away from that. You know, the last Labour government actually did start to look at this. All the issues about early intervention, social and emotional development. The first thing Michael Gove did was to take the word children and families out of the name of his department, and the new schools minister, Nick Gibbs, sorry, I'm going to get very political now, says that, described any focus on the social and emotional development of children as ghastly. I mean, that's what he thinks. So we've repointed the entire curriculum towards academic performance with no space for anything else. So we've got to get back to what goes on in the home, and I think that does involve decent housing. I mean, that's absolutely critical. On this particular day, we should be recognising that what happens in the home and housing is crucial. Access to professional support, power to pass on educational advantage, and, you know, and it's not only about poverty, because as the EPE, the Effective Study of Preschool Education Project showed, what parents do is more important than who they are. So all parents need support and come out in and out of risky times in their lives. We've got to be ready for support for parents at all times. So, you know, you think about HS2, £54 billion. I mean, Alastair's a supporter of it. I'm ambivalent. But, you know, if we can put the money into these big imaginative projects, like a train that runs halfway across the country, why can't we put the money into a big imaginative project about raising the life chances and the happiness and well-being of all of our children? It seems absolutely critical. There's one for the Labour Party, Daniel. So finally, I just want to say something about school reform, because it's become a bit of a dirty word, isn't it, associated with sort of academies, Michael Gove, what have you. But there is a case for progressive and good school reform. And, you know, we haven't really got a definition of what makes a good education, but I think people are moving towards the idea that academic education matters. Obviously, a clutch of good results is absolutely important, but it's got to be allied to these non-cognitive skills. Now, I could list so many, and many of them have been on this board this afternoon, you know, resilience, confidence, aspiration, initiative, self-regulation. So many of these things start at home, but there is a way of bringing that into education, and that involves looking at the curriculum. It involves looking at school cultures. If schools are not happy places, then the children probably won't be happy. And a lot of schools, in spite of their best efforts, are quite stressed places, and that's largely because of the high stakes accountability. The quality of relationships in schools, but particularly on the impact of tests, too many tests and too many exams on what goes on in school, and not enough emphasis on the other things. Now, I think it's quite disappointing, actually, that none of this was really discussed in the election campaign. There was no real, I mean, actually, all the policies manifestos, excuse me, Daniel, were very bland and not very progressive when it came to education, apart from moving money around the system without any real reform. So I'd like to see massive reform of the curriculum and an emphasis in the accountability system on what makes a happy, well-balanced child, as well as a child who does very, very well and get the passport onto university or the vocational qualifications or whatever happens next. Thank you very much.
Well said. See how to get a 30-minute speech into 5 minutes. That's the way to do it. I've waffled on for 45 minutes. Dickon, can I start with you? We've heard a lot about the kind of the state of play, as it were. You've been on the front line. We talked about where the front line is, but you are right on the front line. How stretched are you, and how do you analyse the extent to which the problems are growing, and how are you dealing with that?
CAMS, so I'm a child and adolescent psychiatrist. My clinical work is now with what very pejoratively used to be described as the hard to reach. So these are young people who are very rarely in schools. But a lot of our work is trying to help them get back into schools. And I spend part of my week doing direct clinical work and now part training lots and lots of teams around the UK and around the world in an approach to try to kind of address those needs. So I get a privileged sort of look into lots of CAMS and more multi-agency services around the country. We're at sea. You know, and in a sense, we're at sea in a sieve. I think that the crew are...
So it's not very strong and stable.
No, it's not. The crew are extraordinarily, you know, expert. There are amazing sort of individual skills, but, you know, we're spending an awful lot of time just bailing out water. And, you know, it was very interesting looking at, you know, this... It was described as the old model of tiered care, tier 1, tier 2, tier 3, 4. Actually, it's still tiered care. It's kind of, you know, lots of tiers. And that stretch, I think, is one of the things that certainly in CAMS services is just desperately difficult. You know, there aren't enough beds for adolescents, but actually the problem is not that there aren't enough beds. So there's not enough outreach services that can intervene effectively, intensively in people's homes. If you've got good outreach services, you don't need any more beds. But beds make more sense to politicians, with greatest respect, because they can see them. Outreach services that are integrated in with families, with schools, are much more difficult to see. But so there's a real risk that we respond by just pulling very large levers that do things that look great, nice new shiny unit. The problem with adolescent, I ran an adolescent unit for quite a few years in my own career, is it just takes young people away often from the families and the communities that actually are where.
And how big a problem was that I identified about kids and young people being having to be treated outside their own areas?
Just insane at the moment. I mean, that is the only word I can
How bad?
use.
I mean, what sort of...
Well, I've worked in child mental health in the NHS since the early 90s. It's just, there is no comparison to how it's been in the past. And I've been through tough times, but it is...
Daniel, can I ask you, how do we get... I mean, you weren't here earlier, were you?
No.
So we've really been talking about how the campaign to get more understanding is going well, and yet we still seem to have mental health services, and particularly mental health of young people, service of young people going backwards. What do we have to do to get this further up the political agenda in a way that it's not just David Cameron and Theresa May making nice speeches, but actually change happens?
It's a really good question, isn't it? Because in fact, people have been talking about this for some years. When I was elected 2 years ago, I was horrified to find the waiting time just for assessments in this county, in some cases with CAMS, was 18 months. And that wasn't because people hadn't been trying. I mean, at the time, Norman Lamb was the mental health minister, who I've got a lot of time for, and Julian, my predecessor, who was very interested in his issues, who I think did his best. But that was the position we found ourselves in this county. So the rhetoric at the national level was fine, but as you go down through the way resources are allocated within the health service, it just wasn't working. And I think that is a problem. Now,
how do we change it?
Well, all the parties in their manifestos this time round, bland or otherwise, I've heard our manifesto called a number of things over the last few weeks, but bland wasn't generally one of them. But all of them have got welcome commitments. I mean, Labour's manifesto talked about ring fencing locally. I mean, but the truth is, if you've got a health service system which is under acute strain and pressure at every point, and you've got Adam Brooks, which was basically on alert through much of the winter. I have some sympathy with health managers who are trying to manage those issues. But if we're ever going to do anything about mental health services, it's going to have to require more resources in, and it's going to have to require locally the money actually getting to those people. I mean, we've always had a problem in Cambridgeshire, I'm afraid, within our health economy, because of the overwhelming dominance of having a big teaching hospital. And that has skewed resources within this county for a long, long time. Add that to the historical underfunding of Cambridgeshire's schools, and you absolutely see the problem. And I pay tribute to people like Rebecca and the work they're doing. I mean, I remember coming to see you at one of the schools, one of your partner schools, and on the way out, the head teacher said, "Oh, by the way, I've just been told I got a £65,000 cut in my budget." Now, that does not add up. So, I mean, I know Labour politicians always criticise for saying it needs more money, but we're in one of the wealthiest cities, in one of the wealthiest countries in the world, and it does. And there is money. We've just got to get our hands on it.
And Carol, can I ask you, how are we actually going to, assuming that the demand could be met, how are we going to train sufficient well-qualified professionals? That was a question from one of the trustees. How are we going to train sufficient well-qualified professionals to meet the need for counselling for children?
I think we have to accept and understand the inconvenient truth that this work needs time and attention. It is not a quick fix. The course that we run at the University of Cambridge takes 4 years. We need to invest time and money in people. As I was saying earlier, it is the person of the therapist that matters, and it takes time to develop those relational skills. And if we're going to ask teachers to do more of this kind of, tier 1 work, as you were saying earlier, they need time to do that, and they need time to acquire those relational skills. And people don't want to hear that. There are no quick fixes in this kind of work. So we have to accept that it's going to cost a lot of money. It's difficult, it's complicated, and we have to invest in people. We have to invest in education of teachers in terms of continuing professional development and changing the initial teacher education curriculum. One of the things that happened in 2010, as I'm sure people know, is the Teacher Development Agency was closed. So there is no funding now for continuing professional development of teachers. And courses in this territory are closing in universities across the country. The course in Reading has gone, Leeds has gone, Southampton has gone. Last week I heard that the very precious person-centred course at UEA is now closing. It's closing because people are not willing to put in the money to do the labour-intensive work. You know, my tutors do one-to-one work with the students, going through videos of their practice. It's very labour-intensive and it costs money. And universities are still in austerity measures.
Do you feel...
Sorry, I'm ranting.
No, you're right.
Believe me,
You're
that was
right.
not a rant. Do you feel like you are in the poor relation Cinderella service still?
Yes, no, there's no doubt in my mind. Mental health has always been the Cinderella. It was the Cinderella when I was in medical school, and it's the Cinderella in terms of funding, it's the Cinderella...
And it hasn't changed?
Absolutely not.
It's gone worse?
Except that we've got all the interesting stuff happening in our field. Because the rest of medicine is phenomenally boring. Mental health and research in mental health is where mainstream medicine was about 100 years ago when they invented chest x-rays, ECGs. They could start to look inside at the function of organs. Well, that's just come on since I started to do psychiatry. We've got functional MRI scans. We can actually look at, completely unimaginable levels. So where the research is now is really exciting. I'm primarily a clinician, but I'm very, very sort of interested and sort of drawn by that. So, I'm going to hold that a lot of doctors are highly selfish individuals, and we kind of go where it looks sexy. And, mental health is way sexier than most of the rest of medicine.
And I was showing you earlier this thing from a survey of medical students around the world, and it's all the mental health, all the mental specialities, they're all literally at the bottom of this table. It's called a disease prestige league table, if you can imagine such a thing. So people love myocardial infarction, and they love spleen rupture, and they love brain tumour and testicle cancer and pulmonary embolism, but you're all down the bottom.
Yeah.
It's hopeless.
I think that speaks hugely to the entrance criteria, certainly to medicals. If those were medical students, that would entirely make sense. That medical students are selected on criteria of academic excellence, person-centred skills. There's a lot of effort. I don't want to demean my colleagues who recruit, but they're generally not. That's not their high focus, and particularly doctors are not very interested in things that they don't understand. We're into.
Do you know you and I were saying outside, sometimes you speak at conferences where they start putting stuff up on the wall.
Is it happening?
Are
they saying shut
it's
up?
Happening. Shut up, Dickon. These are questions coming in through your wonderful Glisser. Do that. I see. There was one that's already gone that I saw, which was something about what you can do in specific schools to help. Who's the best person to answer that? What can a teacher specifically now? What can teachers do that they're not doing now?
I can probably answer that.
Yeah.
So, or in part anyway, I suspect that if it's the more detailed stuff,
Bloody hard to
Carol.
read this, by the way.
We're very close to it. I think, actually really supportive head, we talked about that wheel of well-being. Actually a really supportive head who is able to encourage teachers to look at these things, to encourage professional development in these areas, and really put emotional well-being at the heart of what we do. And Alastair talked a little earlier as well about, actually it takes quite a brave decision to say, I recognise all of these other things, but I'm going to put emotional well-being at the heart of this. But the fact is that we have this wonderful spin-off, which is education attainment actually goes up So it's okay to put emotional well-being at
So you
the
actually
heart of
think
it.
what you can do is actually just say, this is what we're doing, and then do it?
Yeah, absolutely. So if you look at really good school counselling, we were talking about, it has to be really good. But if you get really good school counselling services in, it's hard in times of austerity. But if you put that emotional well-being at the heart, which supports your teachers, which supports children, actually you will see this knock-on effect also of attainment, because we know that children who are in distress don't learn, and children in distress have a big impact on teachers.
Daniel, there's a question for you. How do we advocate against cuts in school budgets? Because as you know, ministers are under pressure for spending on everything, and how can we fight more effectively to ring-fence funds for children's mental health? What can we actually do?
Well, obviously the first answer was change the government, and we tried that last week, and we're still trying. But more seriously, I'm encouraged by the fact that I understand that some of the ministers have changed. I think there were a couple of new appointments. I'm not sure who's been sacked, but given some of the real negativity that has come from efforts at cross-party. I mean, the Cambridgeshire MPs actually worked very well together in the last Parliament, trying to make the case. But when we went to see Nick Gibb, it was like banging your head against a brick wall, quite frankly. There was absolutely no sense of any movement at all. And if you've got that position, then it's very, very difficult. Now, I hope that with the current government, obviously, in a much more fragile position, there will be Conservative MPs who will have the courage to actually do what the DUP are doing for Ireland. Well, I want to see it being done for Cambridgeshire and being done for London as well. I mean, we can actually exert leverage now if we stand together. And that's what we should be doing. So there's no doubt that the money is there in this country. I mean, again, the Labour manifesto was, people attacked it because some people said you can't get 49 billion and you can only get 40 billion. Well, I'll take the 40 billion, quite frankly, and that's what we should be doing, because it was disgraceful when you look back at the cuts in business taxation. It's not just looking forward. This is money that's been foregone for the last 5 or 6 years. Austerity wasn't actually necessary. It was a choice. Well, the country's just rejected it. So my question to Conservative MPs across the country is, you've seen what's been going on, now work with us to actually address some of these issues.
Do you think though that Labour has had mental health sufficiently high up the agenda within the health service? We do have quite a traditional view of, you were talking about shiny buildings and beds and hospitals. When we talk about the NHS, we don't really have it centre stage.
No, although let me pay credit to my colleague Luciana Berger, who I think did a lot of work, came here, helped me campaign before the last election to save the life work service here. We've got national attention on that kind of thing. So yes, you're probably right. Traditionally, none of the main political parties have done enough. But as I say, I think the rhetoric is now there. It's no good having the rhetoric unless you actually turn it into action.
Can I just add that yesterday I was speaking to the head teachers in West Sussex, which is one of the other lowest funded authorities in the country, and they've actually been at the forefront of this campaign to get the funding, school funding increased, and they're definitely going to step it up. And in fact, one of their local Conservative MPs hung on to his seat with a massive cut in his majority, and he has gone from being somebody who basically brushed them off, as you say, to now wants to hear all about it. So I think this is a door that's slightly open, but we've got to keep pushing at it, and it's very important that head teachers in schools across the country get together to do this, because heads have far more power than they realise, and I've always thought head teachers were far too timid, frankly, when it comes to political lobbying, and you've got a very good opportunity here to really make change in this thing. I think the government will have to find the money, they'll have to make the fair funding formula fairer than it is, but it will only happen if everybody gets together and pushes in the same direction.
Yeah, can I just say that I don't want us to think, anyone to think that we've not kind of consulted other politicians and things. We had Heidi Allen of the Conservative Party, Lucy Fraser of the Conservative Party, and as Daniel mentioned, Julian Huppert, formerly the Lib Dem MP for Cambridge, were all really interested in coming but couldn't make it. And I think it's just really important to say that there is a lot of consensus around understanding that mental health is really important. It's changing those feelings into actions that is really important.
Dickon,
I'll do something very dangerous, which is try to get some nuance, and possibly a bit controversial too.
Go on, we like controversy.
Good, I thought so. There's a risk that we're all just really agreeing that we just need more money, and that's the nuance is that what I want to talk about is a sort of both and thing, not an either or thing. I think there's a real risk as we talk about services and specialisms that what we miss is what's required is actually something much more fundamental, a kind of step change in the way that we think about mental health. And I thought that some of your comments were actually really on that, you know, we're all mental. The opposite of being mental is you're mindless. Yeah. So when I talk about a step change, I think there's a systems problem when you come in as an expert, which is that the more expert I am, the more inexpert the person I'm talking to can end up getting positioned as. And that there's a real risk when I work with a family that if I'm the most perfect family therapist possible, the parents just feel worse rather than better. And there's a risk that as I come into a school and become incredibly expert, that in some sense the staff in that school feel less competent than they already are, and they've got this thing that I haven't got, which is called relationships with the kids, and we lose confidence in what that relationship means. I mean, that is, and that was really the substance of the what you, I'm addressing you as if you're all teachers, and I know you're not, but there's a promise. But what you have is relationships, and mostly relationships of trust. And so there's a sort of industrialized model of mental health care where I've got treatment A, and then the question is just, how many deliverers of treatment A can I have? And then a family or a child in crisis asks for help, and all I've got is treatment A. Actually, they may not want treatment A. They may just want someone just to talk to for a bit. Someone who could get some advice from somebody else. And often we end up offering,
you don't have time just for the talking to...
No, but what we're trying, so I think one of the sort of, if you like, the step change thing is a move from this kind of industrialised model of kind of mental health provision, or it's not me, it's over to the expert, to what I would talk about as a sort of distributed or an intelligent network, where we actually take seriously this thing that we've spoken about for, 30 years. We've talked about integrated care. Integrated care doesn't mean we create a machine where everything works together. It means that we create a machine where we actually know where people are and who knows what, and we can find our way to expertise better. And
well,
that's part of
let me ask
sharing.
this to anybody on the panel. What could be done to improve the area that we're talking about that doesn't cost money?
I think actually if you had more joint... If you said, in our area, the priority will be children, you run everything up past what's best for children. I say that on a national... Yeah. I'm not saying that flippantly, because we've got a women's minister and an equalities unit which looks at things in terms of gender equality. We don't look at things in terms of children. If you had a children's minister who was tasked with looking at every policy in terms of how it would affect children, a lot of things would change very, very quickly. And look at something like the London Challenge. I mean, that's what happened in terms of improving London schools. It distributed down through the system, right down to every single teacher. You could do that on a local level, and where these things have worked well is where every single agency, that's the health service, police and schools and social work, have worked together, in some cases pooled their budgets to get the best outcomes for children. Now that is a big step change in a lot of areas to happen, but I think it's that sort of thinking that has to happen. And I always think if you can't affect the national situation, which sometimes one feels very frustrated about, especially at the moment, try and affect what's going on in your community. And maybe it is possible if people do work more closely together and pool some budgets, we can start to get some different thinking on some of these issues.
Daniel?
Well, I would say stop the marketisation of services and go back to letting professionals do what they do best. My partner was a mental health social worker for many years, and she got so fed up with being stopped from doing what social workers used to do and becoming a commissioner of services instead of budget holder. Yeah. I think it's just the wrong model. The reason I wasn't able to join you earlier this morning, I was meeting a group of men in Cambridge Market who are, in the jargon, mental health service users. And they are completely fed up with the local services, and their service is meeting around the tea stall in the marketplace. And what they actually need is someone to turn to at times of crisis, who's there, not someone who answers the phone and says, oh, we can put you through a triage system and all the rest of it. And my partner used to do that long term. She knew that people didn't recover. She knew that people go through bad times, and it will be the same with young people too. But we've got such a market-driven model now of providing services that that can't work.
Okay, now we're running a little bit late. We're going to break for lunch, and you're speaking later. I just want to, the question at the bottom there, very, very briefly, all of us, starting with far end Carol, what single action could we take now to address the mental health crisis in schools? Very, very, I'm going to do a David Dimbleby. He's like, he goes, It goes like that.
Put a school-based counsellor in every school in England.
Okay. preferably with a blue smile badge.
Well, that's what I was going to say, more blue smile workers in schools.
Okay.
I don't think I can answer that because that's exactly what I'm going to say.
Okay.
Well, okay, I would go with providing more supervisory support for the teaching staff and teaching assistants.
Well, I agree with all the others, so I think I'd go back to my point about reform of the curriculum assessment accountability and strip out these exams which aren't needed.
Right, and I'm not going to go for anything because it's too late. Right, thanks to the panel. Thanks for listening. We'll all be hanging around out there and have lunch. Thank you.